Happy Monday, everybody. How's it going? I hope you guys had like the best weekend. I know we're in February, but, and I know it's like cold outside in most places at this point, even if you're in a place that's not supposed to be cold. um, but at least here, the weather was definitely calmer. Even though it was still cold, it wasn't like biting cold and like a nor'easter or super wind event. Nothing like that this weekend. So that was pretty cool because I got outside and it felt great. I usually shelter when it gets like that because storminess, crazy. So I hope you guys have had a great start to the week as well. Great topic today. Great topic today. I'm really excited to share. But before we get into it, I'm going to set up my screen here. So, hello, welcome to the It's Not You pod, the place where your symptoms finally make sense. I'm Jackie, your perimenopause fat loss coach. I spent 15 years coaching figure skating before my own hormonal shift rewrote everything I knew about my own body. Now I help women like you burn fat, fix the fatigue, drop the bloat, and stop buying the bullshit that it's just your age. Doesn't have to be that way, ladies. We all know that. If your body's been acting differently, you're in the right place. So let's get into it. I want to talk today about gaslighting because we do a lot of it. If you've ever brushed off your symptoms, the fatigue, the heaviness, the bloating, the brain fog, the mood swings, the weird cycles, you're not alone. Most of us do this for years before we realize what's happening by telling ourselves. And I know that we all can identify with these. It's just stress. It's just my schedule. It's just busy season, right? I'm just getting older. I think that's maybe the number one that I stuck in the middle there. It's probably nothing. I'm just being dramatic because isn't that everybody's favorite thing to tell us? We're just being dramatic. We just want attention. I'm sure it'll pass. This is probably normal for my age. You downplay, you rationalize, and convince yourself it's fine. And everybody else gets in on the party because everybody else wants to tell you that too. And it's not because nothing's wrong, right? It's because you don't want it to be something you don't understand for sure. We all don't want that. Take a little bit. I drink over here. We never want it to be something we don't understand. But here's the thing that happens when we gaslight ourselves. We've been conditioned to tolerate discomfort, power through, be the steady one, the reliable one, right? Not to make it a big deal, to basically consider everyone else first. This is something that we talk about week on week here. We're always spreading ourselves thin and putting ourselves on the back burner, in the name of everyone else. So when our body starts whispering and later yelling, the first instinct we have normally is to minimize it, explain it away, and, somehow make it smaller, making ourselves smaller. But these symptoms are not inconveniences, they're signals. Okay. The fatigue, the bloat, the cravings, the mood swings, the brain fog, the cycle changes, the anxiety spikes, sleep disruption, weight holding. Ladies, we all know these things. We've been there. And the worst part is we don't dismiss them because we don't care. We dismiss the signals because we were never taught how meaningful they really are. And that's important for us to consider now. This is biological communication and information. It's not our body just trying to be annoying. You're not your own younger sibling. You got to pay attention to this stuff, but we're taught not to, right? So, this is the time to consider shifting our identity around those beliefs. There comes a time because you're not the woman who overreacts, but you're the woman who's underinformed. You're not a complainer. Your body is speaking. And why are you trying to shut it up? It's not going to shut up. Pro tip. It's just not. And in my personal experience, I actually was not trying to shut my body up. If you've been following me for a little bit, or if you're new, for those who've been following me, you know that I had a hysterectomy. Now it's almost 2 years ago that I had the hysterectomy, but I had a very long road to recovery. I am still in recovery. I went into it being severely anemic due to lack of medical care, due to lack of these topics being, I was told a different gaslight. I was told it's my cholesterol and I need to go on a statin drug. Meanwhile, cholesterol spike is one of the hallmarks of perimenopause. And so as a result of this, a years long back and forth went on because I did not go on the statin drug. And my body kept speaking. It kept whispering. And then finally, at the 3rd year, when I was getting my blood done, the typical blood work, they didn't even do a full panel. Gee, your cholesterol spiked super high. Let's do a full panel and see where your hormones are at. No, that would have been the easy discussion to have. We went on another 2 years after that first one. And by the 3rd year, I was severely anemic. My blood was at a 9 because I was bleeding so heavily from perimenopause. It took me 4 months to get into my OB to even address the situation. And I tried to get a sick visit. They told me to go to urgent care. And ladies, we know urgent care and OB patients. What urgent care is going to take an OB patient? That's absurd. So, so my blood was at a 9. And a week later was when I found out that I would be requiring a hysterectomy, and very quickly. And they also had to biopsy me because I had a fibroid that was irregularly shaped, which is an indication of potential cancer. So they wanted to take the biopsy right then and there in the office. Long story short, I did have to come back because there's no way they're digging in there without some kind of a prescription assist. Ladies, you know what I'm talking about. Just a little, something to calm me down, something to help cut the pain because they had to dig a little deep to get in there. It wasn't your average appointment. So, a week later, I came back. They tried it in the office. They could not get enough of a sample, substantial enough sample. So we had to schedule a DNC. So that took me 2 weeks. Then after the DNC, I still needed the hysterectomy, but they confirmed that it was benign, thankfully, because if it was the other way, I would have had to go to the larger hospital system because I do not live in a city at the moment. So that being said, I was able to stay with my surgeon, who became my OBGYN, my new OBGYN. My old one retired. Good for her. So I stuck with my surgeon, and my surgeon did an exceptional job. By the time I met her, my blood was at a 9, just to recap. And I needed to have my fibroid tested for cancer. So we had to take a sample of that, and we scheduled the first available slot for a hysterectomy because I called the hospital and I found out they do not prioritize hysterectomies despite the situation. So I continued to bleed heavily. It was a daily bleed. It was very uncomfortable. And that is the story. So got the hysterectomy, and I got to tell you, sitting in the recovery room, I felt like I could run a marathon by the time I got into that recovery room. My body was so fucking relieved. And I'm telling you this story because your body will whisper at first, but it will speak louder if you keep ignoring it. And I did not even intentionally ignore my body. I just knew something else was happening. I kept questioning my doctor. There were things nutritionally that I did outside of the office, which is what I do here because I'm not a doctor and I do not play one on TV. Every single one of my clients knows that, but we handle outside of the office here because checking those boxes, my doctor, actually the one I fired after all of that, turned to me and said, I manhandled my genetics because I got my cholesterol down dietarily and through exercise. That is not manhandling your genetics. That is creating a response in your body. And my body happened to respond in a way that was advantageous for my situation, for the mix of events going on inside of me. So your body will continue to speak louder. Your biological information does not change if you do nothing. So I changed the stimulus. Diet, I didn't change back then, actually. It was really just getting back to exercise. And as we know, during the pandemic, gyms were a dangerous place to be. So I wasn't lifting like that, but I was getting out every day and I was walking. But because my perimenopause had picked up so much, I needed to counter it with strength training. And so I did that, and my body responded in kind. Ladies, strength training in midlife is key. And not because it helped me. It's actually known to actually help scientifically. Studies have been done. I know that we try to avoid it because we don't like exercise. I talk to women every day who are like, I'm going to take this pill, that drop, this powder. Don't want to do it. Not an exercise person. It has nothing to do with being or not being into exercise. Nobody cares about what your interests are in this department, like your body doesn't care, I should say. You find something that works for you because the plan that you're going to do is the plan that you're going to stick with. The one that you enjoy is the one you're going to stick with. So that's what we do at Anywhere Fit. We find your pathway to health. And I work with you one-on-one to find what works for you. We look at your stimulus. We look at what's going on in your body. We look at what your data is telling us. And it's not just weighing yourself at the end of the week. It's measuring. It's how are you feeling? What is your digestion like? It's a plethora of other data points that we take in and we consider because it could be a lot of things up to and including your cycle, right? So these symptoms, all of this to say, they're not character flaws, right? They're invitations into a partnership with your body. And you stop gaslighting yourself when you realize that it's not that you're too sensitive. You're finally paying attention. Okay. I'm going to say that again for the women sitting in the back. You're not too sensitive for paying attention to your body. You're finally paying attention. That's the key. And now that I'm able to pay attention to my body in the way that it needs in this phase of life, I am able to heal it from the very deep inside out. So I've been through it I understand where you're coming from. Hit me up with any questions anytime and always. I love having these conversations. I love helping. This is why I do what I do. Let's ask ourselves this week, what symptom have you been brushing off that deserve your attention, not your dismissal? Comment or DM me to share. I'd love to help you talk it out and let that guide your 1% shift this week. Okay. And if you're a client, bring this to your check in next week. I want to see where this is showing up for you personally. And if you're listening to this at home, your next step is simple: get your wellness IQ, comment or DM, and I'll send you my free quiz so you can finally understand what your body's been trying to tell you. All right. Thanks so much for hanging out with me today on the It's Not You pod. Remember, I'm here every Monday at noon Eastern. Bring a friend, share this with a woman who needs to hear it, and I'll see you next week.